Zahra Legris, psychiatrička, lékařka Lékařů bez hranic. Zahra Legris pracuje pro Mezinárodní organizaci Lékaři bez hranic jako manažerka v oblasti duševního zdraví. V této pozici několikrát pobývala v pásmu Gazy, odkud se právě vrací do Evropy. My jsme se s ní spojili do jordánského Amánu. Good morning, Mrs. Legris. Thank you very much for joining Spotlight broadcast. You are just on your way back from Gaza Strip. Where have you been exactly and for how long, and what have you been doing there, if you can summon?
Thanks for having me. Yeah, so at the moment I'm in Amman, as you said. I was in Gaza 2 times in the last 3 months. And before that, in December and January, I was there for 2 months. So yes, over the last 6 months, I've been in and out of Gaza, supporting MSF France in our medical interventions there as the mental health activity manager. And in Gaza, since December, I have worked in Deir al-Balah in the middle area, where we have a modular field hospital, which is made from tents. We also had some activity in the south in Nasser Hospital, up until June this year, where we supported with trauma, orthopedics and burns unit in the hospital. And we have a small clinical activity in the north, in Gaza City. Over the last 2 months, I've had the opportunity to visit the north and support our activity there. And it was certainly a shock compared to other parts of Gaza that I have worked in, to see the extent of destruction and devastation to the northern part of the Gaza.
What shocked you the most? So what was, if you compare the situation like a couple of times before and now, what was the most shocking, or what were the most shocking things for you?
I think when I was there in December and January, there was a huge amount of displacement because there was a closure of Netzarim corridor, which is from the kind of 2/3 of the way up into the north of Gaza. A lot of people were displaced and there was not a lot of movement. There was a humanitarian safe zone at that time. And what that resulted in was a lot of people who were internally displaced, living in tent shelters throughout the winter, really struggling with the conditions of living. But on reflection, at that time, I was shocked at their resilience and their ability to cope with the situation with grace and manage their work. Most of our colleagues are local people from Gaza. And at that time, if I compare it to now, they were a lot more able to cope with the situation. Now, there is...
Was it because there was a better humanitarian relief or better approach, or was it just because one could imagine from far abroad that you know, the longer you live under such harsh circumstances, the worse it becomes, or that your patience and resilience actually should decrease. So how do you explain that?
As a mental health manager and a psychiatrist, it's something I've reflected on a lot, that question. And what is it that's contributing to what I saw in the last 2 months, which was a lot more trauma and a lot more expression of distress, which I think is a result of, as you say, the humanitarian conditions shifting. There is no longer a safe zone. There is no area that will be not under an evacuation order or at risk of that. There are no longer there's not always a clear notice before any strike. And within that, then, you have much less food, in fact, very little now, and I think we can come to talk about that later, very little access to water, and the injuries are getting worse, and the health system is further decimated. So it's, I think, multifactorial. But one thing that I have noticed is that this is a population that's very has inherited generations of trauma and conflict and have a lot of resilience of dealing with it. But the last few months, with the conditions that there are in Gaza, has really impacted people's resilience and ability to cope. Not just because it has gone on for so long, but also because the resources that you need to have basic security, food, shelter, a safe space, is not there.
Mm-hmm. You have mentioned just a short while ago there are Balakh area, and United Nations Office for Coordination of Humanitarian Affairs has recently issued, I think today or yesterday, has issued a statement warning about mass displacements ordered by the or issued by the Israeli military. Because I think that in the report, there was that estimated 50,000 to 80,000 people who have been already displaced multiple times are going to be forced to move again. Do you have such news? Is it going to affect your organization as well? And how does it going to impact the situation in that area?
Yeah, I think it's a very valid thing to bring up. It's very concerning and a significant change to see ground operations and extensive evacuation orders in the middle area, which has until now been largely, it hasn't been unaffected. There have been strikes, there have been things happening, but not to the extent in other areas. There's a lot of coordination between international NGOs and the different authorities, including the military authorities. So that's definitely not my specialty, the security and operations, but I can say that there's a lot of dialogue. However, that doesn't mean that it doesn't impact our activity. And what we've seen in the recent months is, by the way, at least twice a week, displacement orders in different parts of Gaza where there is mass movement of population, and that does impact not just their health and well-being, but also the likely incidents or mass casualty events for the hospitals in those areas. And I think the simple answer is the same reaction will be in Deir al-Balah as everywhere else. But it is certainly an area where we've seen in recent months a concentration of international NGOs working in field hospitals or moving their headquarters because it was perceived as safe. And that's something that they will be constantly reviewing. The need is there. The population's need is very much there. And having been moved into those areas in order to keep operating and be relatively safer, there are areas of the Strip that are not also served as a result. So.
And is there a place where are these people fleeing, or are they issued other places where they can stay safely or relatively safely? Because according to NGOs, the Palestinians have less than 13% of their land accessible for shelter, which really sounds alarming. So are there places where these people can still move?
There is land, and when displacements happen, you see people moving the belongings that they can carry, and you see to a really alarming degree how well children and families can set up camp. And I'm always struck by the amount of work in community that young people are doing in this place to set up. But it is a shelter made of plastic and wood, trying to have some semblance of dignity. And there is no guarantee that that area will not be struck.
Does it include, or does it affect, you mentioned that very briefly, does it affect you as an organization or the humanitarian workers as well, or MSF them yourselves? Because I can imagine that you have a network of hospitals. So what does it mean for you? Like, are you going to move those hospitals somewhere else, or how does it influence the dynamics on the spot?
It mostly influences us in terms of where populations move, who's injured, and what we have to respond to. We have a whole network of logistics and operations that can liaise with authorities to understand whether we're safe to keep operating or not. So there is a semblance of that kind of humanitarian code and communication. It mostly affects us in terms of what we might see. So in the last few days, nearly 1 week, there's been a really large number of mass casualty events, more than in the past 2 months, around aid distribution and around the entry of trucks or food aid. And they have overwhelmed hospitals in the areas nearby, such as in the south near Khan Yunis and in the north near the Netzarim corridor. And as a result, because not all hospitals can respond at every level, we coordinate with each other to relieve some of the burden of other patients so that they can keep responding to mass casualty events. But I think it could seem like a normal incident in a war zone, but it's not. It's been very striking and more unusual that we've seen mass casualty events almost every day for the last 6 weeks, even for a context like Gaza.
What kind of casualties and problems are you dealing with most? You are a psychiatrist, so of course that's going to be a different branch. But now I mean in general, as doctors in the field hospitals.
Yes, so our operation specifically in the MSF section I work with is trauma, physical trauma, orthopedics, broken bones, and burns. So we see anyone and everyone, and we have a specialized activity around significant needs for those medical issues. And what we've seen is many more multiple fracture injuries, more complex burns, and we've seen larger numbers of patients needing them than we had before. In other sites, there are reports, and this is not from our activity, but there are reports of more gunshot wounds and other more direct injuries that's not from blasts.
You have sent me a couple of pictures which the children you work with draw. Very sad pictures describing the situation. Is it part of your? Is it part of the healing process, or is it just an activity which you deal with the kids? And what kind of help can you give them in such harsh conditions?
Yeah, so our activity is very much from the mental health side, focused around integrating with the medical activity. So the idea is that everyone needs a bit of mental health support at the moment, and we aim to try and improve the medical healing process and reduce the trauma as much as possible while they're in with us medically and for their follow-up for their wound care in the outpatient department. Inevitably, we come across quite a lot of trauma, grief, and anxiety. And in the adults, it's moving more towards a depressive picture, which is different to how it was maybe 6 or 12 months ago.
And now we are talking about children specifically, or adults as well?
With children, we're seeing a lot more of the trauma and anxiety and behavior changes. So manifesting as lots of hyperactivity, maybe irritability or fear, and a lot of kind of refusing medical treatment. So we do a lot to try to bridge the gap between medical activity that is life-saving, but also getting them to feel that they're engaged and not re-traumatized by the experience, because a lot of them have obtained their injury in a very traumatic way. Many children losing all of their siblings and parents in the process. What I noticed a few weeks ago is that a lot of the children that we had to break bad news to about the fact that the caregiver, their grandmother or aunt, was the only family member left, and we had to support with that news. A lot of them are under 8 because they're small enough that when they hide and shelter from a blast, the debris doesn't hit them in a way that gives them a life-threatening injury. They are in a hospital. They've had surgery, extensive burns, so that's hard enough. And then having to go through that process without a caretaker or somebody who is your support system is one of the initiatives that we try to help with. And in that, we have a large number of counselors, psychologists, and social workers who help to support the patients and their caregivers in everything that they might need. We also take a trauma-informed approach. We look a lot at emotional regulation, breath work, which is something that children are very good at, I've learned in Gaza. We also do play and bring in types of play with either dolls or different colors or stimulation that allows them to feel a little bit more in the mindset of a child, which is something that they've been out of the habit of in the last 2 years because there isn't school, there isn't this type of structure. They don't have the feedback that children need to have to play and grow. They're living in a lot of destruction and despair. So a whole range of activities. Another type of play that we have, and I think I sent you a picture as well, is we have a couple of clowns that come and a traditional musician that sings to kids and to adults, and that's something that's quite a rich part of the heritage in Gaza for people to remember and be in touch with something that from before.
How many if you would only summon a percentage, how many children who are in need can you actually give your help to, or you can access